Dozens of community pharmacies in England face closure following plans to cut NHS funding by £170 million. That's a claim from the Royal Pharmaceutical Society.
The Department of Health says that it wants to make better use of pharmacists' skills, but campaigners say local chemists do far more than just dispense prescriptions. They provide medical advice, helping reduce the workload of GPs.
Breakfast John Maguire is at a pharmacy in the Hertfordshire village of Wheat Hampstead. Good morning.
Morning to you, Dan. Welcome to the programme from the Grunts on the Ground. Yes, we're in Wheat Hampstead, as you say. Lovely little village in Hertfordshire, around 5 minutes or so away from St Albans. Usual thing, you've got your local pub, your little supermarket up here, and here is the village chemist. Now, they don't just do the types of things that you expect a chemist to do, you know, the cough sweets, the creams and the combs, other things also. It's the real centre of the community here. They do a special Christmas post, a cheap Christmas post at Christmas time. They sell tickets to local shows. People use it as a sort of almost a drop-in centre, really. But businesses like this and many others across England, and we are just talking about England on this issue this morning, are worried about their future because of proposed government cuts.
It's a busy morning in the village chemists at Wheat Hampstead in Hertfordshire. The staff here dispense not only medicines, but also advice, and for regulars, friendship too.
I can come here, I can have a talk with the girls, my medication is sorted, if there's a problem, they'll sort it for me. You don't get that with the bigger chemists. It's so important.
Natalie Crawley tells me how, just days before Christmas, staff here went out of their way to help her when there was a serious problem with her medication.
The gentleman, he delivered the medication to my house at 10 o'clock at night. It was a miserable night, and these gentlemen, they stayed away from their families to fix it, and you would not get that anywhere else. And I don't know what I would have done. I would have got really ill.
Also, just before Christmas, came a letter from the NHS announcing a consultation period and a plan to cut £170 million from the £2.8 billion pharmacy budget in England. This business depends almost entirely on NHS money for prescriptions. Like his father before him and now his son, Graham Phillips is a community pharmacist. He says the proposed cuts would decimate his business.
I won't survive these cuts. My business is already struggling from a financial basis, and I'm not talking about making huge amounts of money. I'm talking about the simple sustainability of the business, the ability to invest in the future in technology and to pay for my staff.
This chemist provides a lifeline, especially for the elderly or those with complicated long-term problems, and it's the only one in the village.
But it's a different story just down the road in the town of Harpenden. The government says that in 40% of cases, there are 3 pharmacies within a 10-minute walk of each other. And here in the town of Harpenden, there's one there, one just 2 doors away, and another just here. There's a 4th one around the corner. But local people tell me that's the number needed for the population. They roughly serve around 5,000 people each.
It is the government's main concern. It wants pharmacies to be more evenly spread, with some based at GP surgeries or care homes, for example. The industry argues thousands of shops will close.
I was a community pharmacist myself for many years in Sheffield. I do understand how hard this is for people. But we do have a responsibility to the taxpayer to make sure that we can provide a modern and efficient, convenient community pharmacy service that allows patients the choice of how that service is accessed.
But the NHS says that pharmacies that are the only providers, one in a village, for example, where there's no alternative, would be protected. They are very much in the front line of modern healthcare, but where the battle is being fought is to determine how, for how much money, and where should pharmacists provide their vital service.
So as I say, this is just an issue concerning England. We've spoken to the governments in the other nations. They say that there are no plans, certainly for them, to cut any funding to pharmacies. But as with all of these things, well, I'm sure a couple of them will be keeping an eye on the situation. Other couple of bits of housekeeping. There is a consultation process, as I said. The government says that will end towards the end of next month. 24th of March, I think, is the end of the consultation process. So there are petitions in a lot of pharmacies. They're trying to get a commons debate together to try to give the pharmacy industry's view on what they think the future of their business should be. They say they're prepared to modernise, but there's clearly a long way to run on this one. We just have to see how things pan out.
Okay, John, thank you very much, Lee.
16 minutes past 7.